difficult past year, and we still need to keep our vigilance. With this talk, what I would like to do is give you some updated view of what the pandemic is doing to us currently in Alabama. Also, I would like to make sure that you have the knowledge that you need to help guide those that you serve and to make informed decisions, informed choices, so that we can use wisdom, so that we all can be safe. I'm going to be going through a group of slides, and just bear with me as I get everything set up here. So I'm Dr. David Hicks. I'm with the Jefferson County Department of Health, but I'm going to be talking from a broader statewide perspective. So I do want to give everybody an overview of what's currently happening in Alabama. So if you break up the state in different zip codes, different regions, different counties, you're going to see a variation on the risk of us getting into trouble with COVID-19 right now. And this is, as of currently during this presentation, as you can see, the counties in red have the highest risk of suffering outbreak due to COVID-19. And that changes. So the low risk is green, the high risk, and the very, very highest risk is red. So there's a lot of red, and that's troubling. And this is related to multiple factors, and we're going to talk about some of those, but I will just tell you that we know, generally speaking, we don't have the highest vaccination rates compared to our counterparts around the United States. We know that there is an emerging variant strains that are highly contagious. And so we do have to double our efforts to make sure that people know about this pending threat. And we have to think about what are the steps that are necessary to change this trajectory, but this is troubling. So this is things that we know about, right? So when we look at what is proven strategies to decrease the spread of COVID-19, and we go back to the pandemic a year ago, a lot of the things at the top is what everyone's familiar with. So social distancing. What is social distancing? Well, everyone's familiar, I think, with the 6 feet difference between you and the other person. That's based in science. So if I have COVID-19, I may not be aware of it. If I cough or sneeze, those droplets float in the air and they land on the ground. But if you're within 6 feet of somebody, that is the danger zone of when you can spread COVID-19 from one person to the other. So that's why if we socially distance at least 6 feet away, the risk of spread decreases. Next is self-isolation and quarantine. So again, if someone is identified to have COVID-19, we want that person to isolate themselves away from others so that they don't spread that. That could be in the workplace, that could be in the church. So you need to remove yourself away from the population so your body can heal up, recover, and you do not spread it, because COVID-19 is contagious. And to note, COVID-19 is more contagious than the flu. So this is a different thing than the flu. And then what happens is, if someone's unvaccinated and they have COVID-19, we will tell them they need to quarantine themselves away from others and people that they may have been around that's been close proximity. We call those high-risk contacts. So say you were around somebody for at least 15 minutes of time the preceding day, you were within 6 feet of them as well, and then you found out just now you got COVID-19. Well, that person is a high-risk contact to you, and it's a good chance that they could have picked it up from you. So when we do what we call contact tracing, you're the contact. You have COVID-19. Anybody else that you have contacted, we try to find out who those people are, and if there's a high-risk contact, Then we will engage with those people, warn them that they may have been exposed, and then they need to isolate away from others as well, because we know that if you get exposed to COVID-19, you don't immediately become infected. It could take days for that to develop in your body. So we don't want to run the risk that someone could be out there that has newly contracted COVID-19. They got exposed to somebody at the workplace or in the community, and then they go about their business and then spread it to someone else. So that's the point of the isolation and quarantining. And that's a strategy to decrease spread of disease. Hand cleaning. This is something that we all know. We've learned, wash your hands and good old fashioned soap and water. And then we have hand sanitizers. Well, we know that it has helped. I will also tell you that when we wash our hands, certain viruses can really get stamped out. So, for example, a lot of us were doing social distancing and washing our hands and wearing masks and all these things last year. We had all-time record lows of the number of influenza cases in our community. But it had limited impact on COVID-19, but it did help, but not as much. And then the face coverings or mask. Okay, so with those, when you put that mask on, remember, if you happen to cough or sneeze, we hope that the mask catches some of the droplets, and that can decrease the spread of that being spread to someone else. And then there's testing. So when we have a lot of positive cases in the community, and we measure that by something called a positivity rate. So if your positivity rate is greater than 5% of the people that get tested are coming up positive, we need to do more testing so we can identify more cases. And then that means we can then help get people isolated and quarantined. And that's our strategy to decrease spread of disease and illness. And then there's treatments. So if you do get sick, most people over-the-counter medications, but then some people have to go in the hospital. And there are now therapies that have been developed that if we get people treated in a timely fashion, it can have a dramatic impact on helping people out. And then the last one, this is kind of that holy grail in a sense, where we've been waiting all this time to get good, safe, effective vaccines, and we have safe and effective vaccines. And we'll talk about vaccines soon. But ultimately, that is the end game, because all these other strategies we mentioned have limited impact. When you put them all together, they helped us stem the tide as much as we could to get us to the point of safe and effective vaccines. But safe and effective vaccines is the end game, so to speak. So I'm going to shift to talking about vaccinations, what's going on in our community, just to give everyone updated. And with vaccines, here, I'm going to show you another map, okay? So currently, at the time of this presentation, look at the shading. So the darker the shading shows what parts of our community, which counties in Alabama have the highest proportion of their residents that have gotten at least one dose of a COVID-19 vaccine. So look at that. You'll see the counties that have the major metropolitan centers and the Black Belt counties have done a great job relative to the rest of the state in vaccinating the population. Now, that has been due to concerted efforts, particularly in the Black Belt counties, because we know that there's a unique set of disparities in those communities, decreased access to services, and the health department put a lot of resources to make sure that information was putting out in the communities, and then behind the information, then you have the resources to come and vaccinate. And that's why you see those Black Belt counties doing very well relative to perhaps some other parts of the state. But if you look at this in context with the whole United States, Alabama is at the bottom. So we cannot get terribly excited and say, oh, look at my community, we have a decent vaccination rate compared to someone else in the state, because no matter how good one county may be in the state of Alabama, we are still not that great compared to the rest of the United States. And that's concerning, because that puts at us all at an increased risk of COVID flaring up, and we're starting to see cases rise now. All right, so I want to break down in a little more depth these different groupings of people that are getting vaccinated and not getting vaccinated. So this is a bar chart, and it's separated based on age groups. So on the far left column, you're going to see the age groups, and then you're going to see the percent vaccinated. So just pay attention to the very bottom, right? So if you see that red color and the lighter blue color, that's people that are age 65 and older. And if you look at the percentage of people vaccinated, you're talking about over 70% of people that fall in that age group in the state of Alabama have been vaccinated. Phenomenal. Unfortunately, as you drop off, and when you get to younger than age 50, it's a dramatic drop off in the number of people that have gotten vaccinated. And that's our biggest concern. Because right now, what we're seeing is the people that are being hospitalized, the people that are dying due to COVID-19 are by far 90-something% of those people are unvaccinated. And you can see, so you took a look at that fact I just mentioned, and you look at this chart, you put those together, and what that basically is saying is that people that are going to get sick from COVID now, generally speaking, people that get hospitalized from COVID, people that unfortunately may die from COVID, by far are more likely to be unvaccinated, and they are going to be younger. They're going to be, generally speaking, people that are younger than age 50. Doesn't mean that other people aren't at risk, but the biggest risk is in those younger folks because they happen to be under-vaccinated. Now, one thing to also note is that just because you've been fully vaccinated doesn't mean that your risk is zero. You have a lot better chance of not having some bad COVID symptoms or getting sick from COVID, but the risk is not zero. So you still have to be careful, and particularly people that have compromised immune systems. Say you're a diabetic, you have lung disease, you have kidney disease, history of cancer, a lot of the other things, and older age. You're particularly high risk because now we're finding out, unfortunately, with this variant strains that are out, and we're having a lot of attention right now on the Delta variant strain, is that for people that are fully vaccinated, if they happen to get exposed to the Delta variant strain, that vaccine that you got, although it's really effective, the effectiveness drops to some degree when dealing with the variant. So that means that people in those higher risk groups still have more risk than someone otherwise. So we still have to be careful. So the vaccines is the best way, but even if you get vaccinated, you still have to keep your vigilance up. So here's another chart, similar, but this is a different data. And this is a breakdown for the state of Alabama, the percent of people vaccinated based on the racial ethnic identity. So one thing I just really want to point out, and if you look at this, so when you look at the bar, if the bar goes further to the right, that means within that grouping, that's a higher percentage of people that have been vaccinated. So the second one from the top is Asian. You see 52% of our Asian population in Alabama has been vaccinated. At the very bottom in red is white. So 30% of white residents in Alabama have been vaccinated. And then if you look at Black and African American, which is the green, that's essentially the same, 30%. So we had a concern early on, a legitimate concern, that the vaccinations were not getting to communities of color equitably. And because there was so much effort to address that concern, we see the same proportion of Blacks and whites getting vaccinated, but that still pales in comparison to Asians. All right, so that's troubling. And then and there's other groups. American Indian is a lot lower. Native Hawaiian is a lot lower. So there's still work to do in subgroups, but I will tell you that particularly for African Americans, they're neck and neck with their white counterparts in the state. But overall, everyone needs to get vaccinated even more. So, that's good news, but there's still a lot of work to be done. This next thing I'm going to show you is pretty interesting, right? This is obviously a map of the United States. And what this is showing is how the CDC estimates what vaccine hesitancy is like in the United States. So I want to give you kind of this big kind of picture. So that darker blue color represents what we estimate as where the most hesitant of our population resides. And you see, up in the mountain, upper kind of Midwest, a lot of hesitancy. And then look at the deep South. So when you go, from Louisiana and go to Mississippi and Alabama, Georgia, and Florida, you see more vaccine hesitancy relative to other parts of the United States, for example, the Northeast of the United States or parts of California or in Minnesota. That presents a challenge as we're trying to get people vaccinated. And so when you look at Alabama, we have additional challenges as we're trying to educate the community about safe and effective vaccines, where we have relatively more of our population that is estimated to be hesitant to even wanting to get vaccinated. And this helps to explain why Alabama's numbers overall are the way they are. Now, there's this Kaiser Family Foundation, a major health institution in the United States, has been doing surveying of the community, for months and months and months since this pandemic has really ramped up. And this is some survey information. And I wanted to point this out because this is something, I have found enlightening. So they polled and they asked the question, what's the likely source of where you're going to get COVID-19 vaccine information? Who's that trusted source? And they asked, and you see based on the age group, how people responded, based on your race, ethnicity, how you responded, and your political party affiliation. And it could be the doctor or the nurse, or it could be the CDC, it could be the health department, a friend or a family member, a pharmacist, a religious leader. And if you look at this, and I'm highlighting this, if you see the bottom line, religious leaders, and overall, less Americans are looking to the religious leader for information about the vaccine. However, if you really drill down and look into this, that of all the groups that are likely to want to receive information from their religious leader, Blacks and Hispanics, you see that very bottom, the 33%, 29%, those populations are more likely to receive information or want to receive information from their religious leader than any other group. So for me, and to this group, that highlights the importance of your role in providing this knowledge and insight to your parishioners. So here's the next thing I want to talk about. So when we talk about vaccines, a lot of people are hearing a lot of different things, a lot of noise. There's a lot of misinformation out there. And one of the things I think that we have failed to show is just looking at the risk of getting vaccinated in context, because we hear people that say, I'm not going to get vaccinated because of this reason or this reason or this reason. I'm hearing about these side effects. And unfortunately, what happens is when there's a side effect, and there's always going to be a side effect to anything, medicines you take, you swallow a mouth, vaccine that you get, that there's always a risk, but it's very small, rare. But they get sensationalized in the media. And then when we hear about a story, then a lot of people see that as affirmation of what they may have had concerns about. And they may say, see, I told you, that's why I'm not getting a vaccine. So look at this. All right. So this is an interesting chart because it basically shows what are the odds of different things happening to you. So the bigger this kind of circle bubble, you see the top green, the odds of breaking a bone while you're a child is 1 out of 55. Okay, very high risk of that happening to you. Look at that, dying in a car accident. 1 in 22 people have the risk of dying in a car accident. That's high. Childhood cancer, 1 in 317, and then it drops down. Now look at these different examples. The risk that we would drown in a pool as a child is 1 in over 10,000 people. Then 1 in 12,000 people have the risk of being struck by lightning. Keep them going down. The odds of any of us being elected to Congress, 1 in 115,000. Now look at the very last one, that tiniest dot, and this is important. The risk of having a life-threatening allergic reaction to a childhood vaccine, 1 in a million. So people talk about, is that vaccine safe and should I get it? The odds of all these other things is by far greater than the risk of something happening from a vaccine. Doesn't mean that the risk of getting vaccine is 0, but we have to put these in relative proportion. So when we're talking about should I do this or not, what I would say is, what are the odds of you getting COVID-19 and having something bad happen? And I think we all know people, friends, family members, loved ones that have either got COVID, been sick from COVID, or perhaps unfortunately died from COVID. Compare that to how many of us in this past year know someone who got struck by lightning. So put the concerns in relative perspective. And I think if we educate people this way, that might help people come to a better sense of having information to make the decisions they need to make about what they should do regarding getting vaccines and maybe their concerns. But this whole pandemic has caused so much collateral damage. And I think we also need to start having this conversation. We know that the amount of people that are using alcohol and other substances has increased during this pandemic. Overdose deaths, narcotics, and opioids have dramatically increased during this pandemic. Domestic violence has gone up. And just mental health concerns that we need to just think about. So with increased stress, situations with my job and how I'm going to make a livelihood, that has led to people having more anxiety and depression. Some people medicate with alcohol or substances. Some people respond to the stressors a lot of different ways that are unhealthy. So this pandemic is not only about, did someone go into a hospital? It's not only about, did someone die? It's what are all the other impacts on this? And so, it is, to me, quite important to think about how we cope with all these stresses and this collateral damage that we're seeing. And here's a few things here. So just for you yourself, for you to keep you mentally where you need to be, and then how you can then translate that to other people. What I would strongly suggest is find a way to de-stress. Some people do yoga, or maybe you may get that through meditation or music, prayer. People garden, or they may find some kind of new hobby. But I think we now have to be intentional to take the time to build that into our normal daily life and schedules to pace ourselves so that we don't have a nervous breakdown and stress, and we need to advise others to do the same. I think we all had to try to figure out how we're going to find new ways to socially connect to other people. So if you're concerned and say, we've been indoors a lot and not interacting as much as we would like, and things are starting to shift there, but we've had to get creative. And so we have these different platforms to do virtual meetings and using our mobile devices to connect with friends and family. But the importance of social interaction is very real. And think about this, even in religious settings, for us to congregate and gather and fellowship together is very important, spiritually, mentally. And we've had to have ways to figure out how we can do this. It's that these things don't supplement that direct human interaction, but it's the best we can do given the circumstances and given the pandemic. Another thing, taking care of our bodies, because we may not have been as active as we used to do. Maybe we weren't able to do certain camps and sports and outings. Then we've had to be more intentional about how we're going to stay fit physically. So that's getting out on trails and walking, or getting on a bicycle, or even just in the comfort of your own space, trying to find a way to do exercise right then and there, in your room. But we have to build this in automatically. And then this is stuff that we all know, but I think it's even more important now, is how do we make sure we maintain healthy diet and making sure that we're getting adequate amount of sleep. These are all ways to help deal with those mental stressors that I was alluding to earlier. It's important, but I think we need to write them on our calendar, lock them in, and then encourage all those people around us to do the same. So now I want to go through things that are particular considerations for communities of faith, because I think one of the challenges that many of you may have is going back to in-person worship services. What are the considerations and things that we need to make, and how do we do it safely? And this pandemic has evolved, so we went from extremely high risk, and number of cases are really high when we're talking about in December and January, and then the numbers have been dropped dramatically. Great, people are getting vaccinated. So now it's, wow, how can we get back to a new sense of normal? How can we go back to in-person worship services? And now we're in this conundrum, I think, because now we're starting to see cases going up. So now the question is, oh my goodness, what do we do as we try to have these decisions about the in-person services, and how do we make sure we keep everyone safe in those settings? So let me go through a couple of those things, right? The first kind of broad category is about safety, okay? So I'll give you a couple of things I think everyone absolutely needs to consider. So for the staff that works in the facilities, and for the congregants that come, still encourage them to maintain good hand hygiene. Wash your hands with old-fashioned soap and water. Now, that's for 20 seconds. And I think we need to just remind people of that. Now, if you don't have soap and water, use a hand sanitizer, but you want it to have at least 60% alcohol content in that. I think I recommend making that readily available to people and encouraging people to do that. Because remember, as people are touching different surfaces, and you don't ever know when you can pick up a germ, and that germ could be COVID-19, particularly because we're seeing now a rise in the number of cases, and we don't know who has what, because you may be carrying COVID-19 and may not be symptomatic at all and not even know you have it, and that you may be passing it on to someone else unbeknownst to you. Now, another thing from a sanitation perspective is making sure that sinks are accessible to people to be able to wash their hands and clean. Also, covering your cough and sneezes. As we get into the fall and winter months, every year we always see an increase in the number of people that are sick. So that basic cough etiquette is when people need to cough within their elbow. It's something that we should always have been doing, and even more so in the context of a pandemic. Now, in your, religious facilities, make sure that you keep ample supply of soap. Make sure people have ability to dry their hands after they clean themselves, the paper towels or the hand dryers, and have enough hand sanitizer available so that people have that as a resource. Another thing that some people don't think about is even when you're wiping hands and you say you have a paper towel, you want to minimize people having to touch the wastebasket. So if they can just drop it into a wastebasket, or there's a pedal where it can automatically lift and then you could drop something in, that minimizes the number of common surfaces that people have to touch. Another thing I would say is don't forget to wipe down doorknobs and handles. People are going in and out of rooms, offices, restrooms. So I think having those wiped more frequently than you normally otherwise would have is really important. So you can consider putting signage up to just remind people to do those things. That's certainly an option. And then obviously covering their cough, and sneezes is something. Now, let's kind of shift with masking. And this all depends on how much disease is floating around in the community at the present period in time. The present time we're in right now, a lot of places say that masking is optional. I think that's just something that you have to use your own wisdom on just to see what the local environment is. But just be aware that a safer environment for everybody is if in mixed company would be outdoors. So when you go indoor, then that potentially increases the risk of people that are in a closed-in setting if the cases are rising and things are going in the wrong direction. So it would certainly be appropriate if you choose to tell people that you expect them to wear masks while they're indoors, but that's something that you'll have to decide and what you feel comfortable with. I would just note that you don't want to put a mask on a child that's 2 years of age or younger, or someone who has trouble breathing, or some kind of medical condition. So that's another thing, is that if people have the option to wear a mask or not, we have to be careful to not make assumptions about people and their situation. And they may have a legitimate reason why they're not choosing to wear one, if that is something that's expected to be done. So just have grace and understanding, but do your best to maximize how much you're protecting everyone. So then we have these high touch surfaces. And I kind of touched on this before, but at minimum, I would daily wipe these high touch surfaces like the doorknobs. But say, for example, you have more than one service going on. Absolutely, I would wipe down these surfaces in between services, before the next group of congregants come in. And you can use also disinfectant sprays as well. So that's just a great practice to have. I mentioned the doorknobs and handles for bathrooms, but also don't forget light switches, because people touch those often. And there's countertops, there's things that we already kind of think about. Now, if there's areas that typically get high amount of traffic and there's and it can get a lot of dirt on them, like entranceways and mats. That's another thing you need to consider, maybe having a spray to kind of help kill germs off those surfaces. Now, next thing I want to talk about is the social distancing and what do you do, in a facility where you're having a lot of worshipers coming in. You really need to think about how do you promote social distancing. And I've heard different ways of doing that. So, for example, if say you have a family and maybe they can sit in X number of chairs or pews, and then there could be a space, a gap between them and another group. I've heard of pews where every other pew is utilized. Those are different ways that people have thought about having social distancing as people are congregating. So I think all those are absolutely reasonable. Um, if you can hold a service outdoors, obviously if the weather's appropriate, that's better than being indoors. But if you're, within a large, indoor space, large is better than smaller. And then an area that gets a lot of ventilation is going to be helpful. So if you have the option to have windows down and have some air circulating, that's always a good thing. Of course, it all depends on the time of the year and the weather conditions. When I talking about social distancing, even beyond the four walls of that church or synagogue or whatever where you're worshiping at. Other thing I think people have to also think about is what about funerals, right? So don't forget to do these same practices of funerals and weddings, things that happen within many churches and places of worship, around the country. But don't forget classes. Maybe you have a Bible study class, on a Wednesday night. Those are also times that you can't forget to also practice these same measures. And having good signage is always good, just to kind of remind people of different things. Now, the other thing that might not be something in the forefront of people's mind is what about these other things that people touch, like worship materials? So you can have hymnals, prayer books, bulletins, fans. Wiping those down as well is important because those tend to get passed from person to person. So this is just additional measures. Thinking about when you pass around the offering or collection plate, is there another way that people could say pay their tithes and offerings as opposed to passing that plate around? And I think that there's other things where you may have a drop box where someone can put their tithes or offering in as opposed to having to pass a plate around. Or there could be ways that you can have people make their contributions, virtually online and apps. There's a lot of different ways that I think we can go about doing this. Another one is just what about as we interact with each other? So I would consider not doing as much shaking of hands and hugging and kissing if there's a high rate of COVID-19 in the community. And that's difficult, particularly because that's what we do as we express love and affection for our brothers and sisters. But in a pandemic, we have to use wisdom as well. So we have to guard ourselves, protect ourselves, and protect others. So you want to maintain that distance unless you have to. Just be careful. And another thing is, what about just food? So we may want to serve a group of people food. Well, what about those utensils that are being shared? So if you can have someone serving a group of people, maybe better than people self-serving and picking up a utensil and then someone else grabs that utensil. Nursing and childcare facilities. These are a lot of religious institutions have nurseries and childcare, and that can be challenging because germs pass and toys pass around. But the more of wiping down surfaces than you normally would or in between use is always great. There's camps that happen during different times of the year, so there's guidance about how to protect campers and youth groups. Obviously, outdoors is better, and then indoors, similar things that we've already talked about. I do think that it'd be important for all clergy to make sure all staff is trained in all these things and vigilant and watching for this. And I think that's just how we all really just work together to make sure that things are safe. Now, there's some additional considerations. So one of the things is I would encourage, if any of your staff or any of your congregants get sick, symptoms of whatever it is, it could be sneezing and coughing or fevers, tell them do not come into church. And if you're in close contact with someone who has COVID-19, stay at home. You don't want to run the chance of putting someone else at risk. And that's not only for like a religious facility, but it was the same thing for the job. If you're sick, stay home. If your kids are sick, stay home. Now, if someone happens to get symptomatic or they're coughing or sneezing while they're in church, for example, and there's a concern, you may want to think about, well, is there a place where you can kind of get them away from others and isolate them as they're trying to gather their belongings and maybe leave and go out? So, that may be something just to consider. And also for your staff, how can you quickly isolate and have a space for people to go? And then just God forbid someone gets sick, really sick while they're, say, at church, and they need to be rushed out somewhere. Well, what is your protocol? How are you going to the ambulance or transportation to a hospital or healthcare facility? So you think through those things. This is kind of like contingency planning, and so these are all things that we all just have to kind of be aware of. And I think all of you have been doing that, but just there may be a few subtle things that you may not be thinking through. Now, for church staff, some churches have employed staff. And so you got to think about, well, some people may be out sick or they may be exposed to COVID-19. So how do you make their schedules flexible? Can they do some tasks remotely at home versus having to come in? All important things to have to think through, because we may be going backwards where things can escalate. And that then means that more people could be calling out sick at times. But how do you maintain operations and get things to still get done? So make sure that people know if they're sick around you, who do they call to notify? Do you have volunteers? And if you're depending on volunteers to perform some function, well, what's the procedures that they need to take as well? And make sure there's a lot of signage for people just to know what to do if they, and make sure you have personal protective equipment around. We're talking about gloves and things if someone, if people need those things. And then always check with your local health authorities. The health department's a great resource. There's big hospital systems that may be close to where some people live, and ask them for any guidance or recommendations. And certainly, I think the health department will always be willing to give suggestions and advice. And then the other thing I just want to say is closing the facilities. And this is touchy, but we've seen this where sometimes there may be an exposure that happens, say, or somebody at church identified they got exposed potentially at the church. And now there may be multiple people that have to get contact tracing from the health department, and they identify, oh, maybe there's 3 or 4 congregants, and this is all common link. They were in the facility, church facility at the same time. Okay, well, what do you do at that point? Well, immediately when you find that out, I would suggest doing a deep cleaning of the facility and take the time to close it down, do the cleaning at the direction and guidance of the health department, and then you'll be able to open it back up. And then obviously coordinate with any of the health department officials that may give you suggestions, or they may need cooperation to help identify spread of illness and disease. You just provide them with the information that they need to know, and they know how to make sure things are all done confidential and in order. And so that's really what I wanted to make sure that you know specifically about what we need to do to make sure that we're aware of what's happening as we're, trying to go back to a new sense of normal, whatever that is, but do everything in a safe manner. And this keeps on evolving and changing. And so we have to stay abreast of all this information. So this forum right here is a way to give you the most up-to-date, latest information. It's the last thing I'll just comment on is the variant strains that we're hearing about. I want to just talk a little bit deeper, and then I'll just end my remarks. Is every virus mutates, it shifts and changes. Sometimes the mutations are benign. That means they don't cause any trouble in humans. And then sometimes they mutate and they cause trouble. And what's happening is the original version of coronavirus has mutated and changed. So we have an alpha strain and a beta strain and delta strain. There's even a gamma strain. And we're getting a lot of attention right now with this delta strain because it is more contagious than the regular version, the original version of coronavirus. And when you have that, what happens is with this virus, particularly this variant strain, it can attach and attack the body and the lungs more easily than the original version of coronavirus. So it not only can transmit easier, but then it can potentially cause more severe illness. So people will be sicker. So this is why we're at a race against time to get more people vaccinated. And the thing that I'm really worried about, and I hope this doesn't happen, is there could be a variant strain that emerges that the vaccines are completely ineffective against. Right now, the vaccines seem to work fairly decent with the Delta variant, but you have to get vaccinated. And if not enough people get vaccinated, we are going to see more and more cases, particularly Alabama, where we're flaring up more than other parts of the country. It's disrupting our lives more, putting vulnerable citizens at risk. And all this is preventable. It's preventable because you can get vaccinated. And if you are not sure if you want to get vaccinated or not personally, or you have friends and family, I would encourage you have a conversation with a healthcare provider that knows your medical history, your risk. If say you don't have a medical provider, well, go to your local pharmacy and just have a conversation. So someone who's has an additional level of expertise and training and knowledge about this, have that conversation. And then also within families, have a sit down and just have it and see what any outstanding questions are, reservations, and if there are concerns, then the question is, let's go get the facts, let's get the information to then settle that question or that concern. And then we have to make a decision. The decision is, are we choosing life over death? Are we going to defeat this pandemic or not? Are we going to make a sacrifice not only for ourselves and how do we protect ourselves, but what about for our family and our community? And I think that's the mindset that we all should be under, that we need to be unified in our approach to handle this. And there are hardworking scientists and medical professionals and public health professionals that are analyzing this information. It's evolving and changing as we speak, having to re-educate, have to oftentimes change some of the things we may have said in the past. And we understand that at times that may limit people's confidence in what they're being told, because it's a lot of confusion, a lot of noise. But there's also a lot of disinformation. There's a lot of people that are purposely putting out hurtful information to confuse people. So still, the trusted resources in my mind is the CDC, the health department, major academic medical centers like these big hospital systems. And I would use those sources as primary sources more than anything else. And if you hear anything that seems of concern or odd or interesting, get to the source of it. So someone says, I heard that the vaccine does such and such. Give me where'd you get that from? Is it a reputable source? What are the facts about it? And if they can't answer that, then you go to someone who has that information, and then you then can make an informed choice. Because knowledge is power, and you need the knowledge, and we all need to work together. So I appreciate your time listening to what I have to say in my comments. I pray that everyone stays safe, and that we return to a new normal.